Hello, everybody, and good evening. Thank you for taking time out again. One more evening with our Foxy family. This is another episode of a very successful series of this year, Gyan Pravah. And the Pravah and the flow is going on very successfully, getting more momentum by the end of the year now. So we are very happy that we have got huge number of audiences, and this idea was really taken very well by masses. And the idea was actually by our own Foxy president, Dr. Sunita Tandulwadkar. Madam is here with us. I would want to briefly say something about Madam now, this time especially because recently she's been honored with one more very important prestigious award, which is the Fellowship Honoris Causa, which only is given to very selected individuals by the RCOG. And considering the fact that I know who have been declined earlier, I can
You
totally tell
don't.
you that this is not an easy thing. Huge respect for the achievements
Thank
that
you.
got all her life. So, congratulations, madam. And speaking a little bit about our very special guest today, and he comes from a lineage, but I would want to focus on his own very starry, shining achievements today, which are which can only come with a lot of passion. So he's an embryologist of great repute globally now, and I'm very proud of that. We have our guest speaker today, Dr. Keshav Malhotra. Welcome, Keshav.
Thank you, Dr. Anu. Thank you, Sunita ma'am, for inviting me here. It's such an honor to be part of this series. Honestly, I was not thinking that I'm capable and worthy of being here, but thank you so much for inviting me.
Thank you,
You've
Kesha.
You're very worthy. Okay, so I think that is very important to highlight. We never call anybody who's not worthy on this platform anyway, so I can tell you that. So now I would request Dr. Sunita to say a few words, and then we'll.
Before I leave. Thank you, Anu. Thank you having our own Keshav on this platform. It's very important that we value and we recognize our own talent in the country than just having all international speakers. But Keshav, believe me, never knew that near 250 podcast series have happened every day, 8 p.m. I'm joining, and everyone before the start asked me, "Are you sure you are committing to too much of joining 8 p.m.?" I said, "Yes, it's a commitment of 1 year, otherwise also." And believe me, Kesha, more than anyone, I'm very glad. It's not because my chairpersons, they always come out with the brilliant faculty. The way they are taking podcasts, the way their interviews going is better and better every passing day. But most importantly is we are meeting the faculty of a repute from educational or non-educational background, spiritual, political, philosophical, so many. And I think if anyone, I know it's impossible to take out 300 hours, but anyone will sit and listen to this podcast. It's a huge collection. I think, Anu, we should start thinking now how we can use this intellectual property of Foxy and what we can do more with it. So today's podcast, I'm both the ART consultants bringing different value to this podcast. I don't know what she's going to discuss with you, but it will be of a great additional value to every one of us. Thank you.
Thank you, ma'am. Thank you so much.
Thank you. Very well said, Dr. Tandulwadkar. And you actually have been doing the whole practice of gynecology, all three practices: obstetrics, gynecology, endoscopy,
Yes.
ART, and now the stem cells. So I can't really think of anybody else who has done everything to that justice and that level. So kudos to you. And we are focusing on one field, which is ART. So thank you very much, madam.
Thank you. Enjoy the podcast.
Thank you.
Bye.
Thank you.
Thank you.
Bye. Bye.
So, very pleased to connect with you, Keshav, on this platform. And I would obviously start by asking you a little bit about your background and journey. So, what inspired to choose embryology as a career, and how did your journey in this field begin, and how's it going?
Okay, so the easy answer to this question is it's going really well. The difficult answer is the journey itself. I think I come from a family where, like, I'm the fourth generation, and all of them before me were obstetricians and hardcore obstetricians before they started practicing IVF. And even with me and my sister, both of us, right from the get-go, right from our childhood, I think we've just seen our parents, our grandparents completely like devote themselves to OBGYN. So for me, I think I would say for Niharika, she was very confused till the end of her schooling that she was confused that she would not want to be a doctor. I was very convinced that I want to be a doctor. And once we entered med school, she ultimately became a gynec, and I was like, no, but this is not my calling. I need to do something which is more research oriented, which is more, um, I think, which I could also personally see growth, and not just personal growth, but also scientific growth. And at that point of time, because I'd seen ART right from when I was like 6 years old, I'd been in the IVF lab finishing my homework with my mom. So I had that exposure. I'd seen microscopes throughout my life. I really thought that this would be a good way to balance both things, like balance the family business as well as balance my own personal ambitions. And that's when I decided, okay, I want to try this out. I did a small short course in Singapore, which I really liked. And post that, I did a short course in genetics in SGPGI, which also I really liked. And I think both of these, like 1.5 month stints that I did, propelled me towards doing my master's in clinical embryology from Monash. And I think the rest is history. It's now been almost 11 years since I've been working in this field, and I honestly have no regrets that I deviated and chose this path, because I've been able to create a niche for myself within the legacy that we have in Agra, and yet I'm contributing to that. So I think it's been a good choice.
Yes, yes, I can see that. So you did have very ready-made options in front of you,
Yeah.
and it just would take a lot of inner passion for something to leave one thing and create your own niche, like you mentioned. So very happy for you. Now coming to some clinical and scientific aspects. I know our audiences would be very keen to understand how you're going to share, and I may wish to contribute something on the clinical side when it comes to the embryology questions.
Yeah.
So, what are the key challenges embryologists face in the IVF lab that patients might not be aware of, and then you struggle to, get them on the page?
Yeah. I think one of the biggest challenges that embryologists face is recognition. I think that's something that all of us really think about, because we're working behind the scenes, and most people don't really celebrate our work as much as they actually should. Um, I have been lucky and fortunate enough that we have our own clinic, and it's easier for me. But I know of embryologists who would be working non-stop behind the scenes without any complaints, and yet when once the clinic gets a pregnancy, it's very like it's not so often that they'll call the embryologist and they will introduce the embryologist to the patient, and I mean, at least celebrate that with them. So that's something that is probably one of the biggest challenges. I also feel that most people don't really realize that it is a very demanding job, because you're sitting behind a microscope for the whole day, and even the smallest of mistakes can have very serious and grave consequences. And I think that's a huge burden to carry, because ultimately we are dealing with life on the microscopic level within our laboratories, and one small error can actually really um, hamper the chances of a pregnancy for that patient. So I feel that that's another big avenue that really needs to be discussed and appreciated more as far as embryology is concerned. And I think the last challenge I would say is that our field is evolving so rapidly that you constantly have to learn new things. Like in the last 10 years itself, there's so many things so many new things that have come up. So just that constant like drive for knowledge and training and adaptation to new things. I think most people would not realize that that's also quite cumbersome, and it's challenging for an embryologist because they don't come with all the resources, especially in our country. So it's not a very easy field, but
I
it's
cannot agree
working.
more with you. Yes, in the beginning, you rightly mentioned about the recognition. We always look up to the embryologist to tell us, okay, what is new and discuss and everything. And when it comes to result, it is very important to share that recognition and for that matter, each and every part of the team, everybody. So with advancements in the technology, how has embryology changed? Do you want to, like you mentioned, particularly in the last 10
Yeah.
years? What do you want to mention, particularly in the last 10 years?
Lots have lot of it has changed, honestly, and luckily I entered the field when most of the transition and technological advancements were happening. So I've been lucky to witness all of it. Um, I would say we can start with vitrification as one important aspect. We've went from vitrification being gold standard for embryo freezing to now seeing a shift in protocols to ultra rapid vitrification, which reduces the time to like drastically. So now it's only a 2-minute protocol that we follow with amazing survival. As far as tech is concerned, the adoption of time lapse in most clinics is something that uh, I think has really happened in the last 10 years. Even though I would say time lapse is still controversial, but as an incubator, it's one of the most robust incubators that we have, and we're seeing AI like softwares and algorithms now getting incorporated into time lapse, where now the AI does the job for us. So it looks at the morphogenetics and it tells us which embryo is the best one to transfer, and it does give very good results. I think genomics is also something that's really coming up, and the adoption in our country is increasing day by day. And I feel that we're moving towards more of precision medicine, if I would call it, and especially in the field of ART, where you look at all of these big like data points that you have for the patient, right from their age, AFC, hormone levels, to the quality of embryos that they have, to the quality of gametes that they have. And then there are so many prediction softwares out there which can actually first counsel the patient to what to expect, second, choose the best path, and ultimately deliver the best outcome for them. So there's so much happening. I think we're moving towards from manual ART, we're moving towards the data-driven science now.
True, true. And apart from what you mentioned in the AI as a part of the embryoscope, are you actually using other AI tools currently in your lab?
I have actually tried almost all of them, right from the new AI softwares, which actually help us select sperms in real time. It's called SID, where like while you're doing ICSI, the AI is actually telling you, it marks the sperm as green, red, and orange, and it's actually telling you which one is the best one to inject. So right from that to, I would say we were one of the early adopters for Life Whisperer in India when it was like being rolled out. Now it's being acquired by someone else. But so that's something that we really tried for embryo selection. I've looked at a couple of AI softwares for oocyte grading as well, and I really like this because what it is allowing us to do now is counsel our patients for social egg freezing. They look at the image of the oocyte, they predict the quality of the oocyte, And then based on that, it tells us out of these, let's say 6 or 7 oocytes that we retrieve from this cycle, the possibility of getting blastocysts or the number of blastocysts that you'd get from the cycle is 2 or 3. Now, in cases where this number is less, we can easily counsel the patient for a subsequent cycle. And somehow patients actually trust that judgment more. And
Really?
I honestly feel that that's slightly shameful for clinicians and
Yes.
embryologists that an AI software is being trusted more than their judgment. But yes, this is what is happening in the current era. What to do?
So the patients are sometimes very subject, like massively different, it's very cultural maybe. I recently had a patient I would love to mention now that you mentioned this patient, that she actually said that I'm not paying to use AI, I'm paying to use you.
Yeah.
She's a CEO of a big fashion brand. And I was actually in a way very happy,
Yeah.
that okay, she believes in me more than my tools. So great, fantastic. So how different can somebody like human mind can be,
It
we
differs from
all
patient to patient.
yeah, we can take the same thing in a drastically different manner, isn't it? So could you explain in simple terms what goes in the IVF? So for those who are not very deeply involved in IVF, and we have large, varied type of audiences, would you want to quickly share like the various processes quickly, like just a fresh
Absolutely.
run? Yeah,
So for our Foxy family, I know there are so many obstetricians and gynecologists in this organization, and it is absolutely amazing how presidents, especially like Dr. Sunita, who run this organization for a year with so many events. I would really want to shorten this by saying that um, we get the eggs from the clinician. I think stimulation, most of you would already understand. So once the patient is stimulated, the eggs are retrieved. We take them in the laboratory. They come with cumulus cells. So our job is to remove the cumulus cells and then grade the oocyte first, look at the maturity of the egg. And once we know the maturity, whether when it's a metaphase 2 oocyte, we generally perform ICSI. So this is what is generally happening in almost 90% of the cycles within our country. I would say IVF is something which is probably slowly dying. I would want it to come back because it is far superior than ICSI. But in those cycles, we don't remove the cumulus cells. We just prepare the sperm, leave it with the eggs, and let it be for about 16 to 18 hours. And the next day we come, we check for fertilization. And once in both scenarios, once we've checked for fertilization, we then culture the embryos for another 5 days. And that's it. Once you have the blastocyst, it's either deciding for transfer or again, in the current era, almost 80 to 90% of the patients opt for a freeze-all cycle. So you freeze the embryos, and when the next cycle, the patient's hormones are slightly more stable. We choose the best embryo using all of the tech that we just discussed and try and give that patient a pregnancy.
great. So I'm sure a lot of them now know what we do exactly. So how do you ensure the lab environment, the air quality, temperature, humidity
Uh,
stays optimal for the embryo culture? What is new, especially in this area?
I think this is one of the most ignored factors, especially in Indian laboratories, because a lot of people would invest in a very good quality incubator. They would invest in the best ICSI machines, laser systems, and I think air quality is something that nobody really focuses on. And it's so important because we know that VOCs can lead to poorer blastulation. We know that VOCs can lead to even biochemical pregnancies, miscarriages within your clinic. So it's very important that we have a air handling unit which has the right amount of air cycle exchanges. And there are certain levels of filters. You have a HEPA filter, which is mandatory. It's put in the air handling unit, is also put in your workstations. And there are better filters as well, like you have an alpha filter, you have potassium permanganate filters, lots of things exist. But the key is to actually monitor them, and that's where real-time monitoring really comes into picture. Now, there are Indian-made devices which can give you real-time monitoring of your laboratory on your mobile phone. So all I need to do is open the app and it tells me what's the VOC levels of my laboratory right now, what's the CO2 levels. It tells me the voltage supply to my equipment. It tells me the humidity of the lab. It tells me the temperature of the lab. And it is fantastic because looking at this, I can then decide what needs to be done. Like, I'll give you an example of this. Last year during the Diwali season in November, we saw a big spike in the VOC levels, and it was around 7th or 8th of November. I distinctly remember that date because I read the news that day, and Agra's air quality was like 453 uh, parts per million of VOCs. And what was happening was that all of these VOCs were then through the air handling unit actually coming into the laboratory because air handling units also take in outside air. We actually had to, looking at that data, we had to shut off the air handling unit, put in temporary air filters within the lab in order to actually ensure good quality being present. And similar thing happened in California as well when the wildfires happened. Most of the laboratories had to shut their AHUs and they actually shifted to temporary air filtration systems within the lab itself. So I
Wow.
think this is the power of data nowadays, and the more you can analyze it, I think the better you'll be able to control all the variables and ultimately give more consistent results to your patients.
Fantastic. That was a very important point that you shared. I'm sure this would be noted by many people. Um, can you explain how time-lapse incubators work for our audience and whether they really improve the embryo selection? So we know that the evidence has been very
Yeah.
equivocal. So what are your thoughts on that?
I am very biased towards time lapse. I think it was my 27th birthday, and I went to my mom and I was like, I don't want any birthday gifts. I want a time lapse incubator. Can you please give me that? And since then, I've actually been using it for a lot of
That
patients.
was an expensive birthday
Yeah,
gift. You could have
I
gotten away
asked.
with some nice watch or shoes.
I asked her for the most expensive gift and luckily got it. But we know that the evidence is controversial. If you look at the Cochrane evidence, it says it's neither superior, neither inferior. So ultimately, the biggest question comes is, can we actually charge our patients for time lapse? And I think if we don't do that, or if you're only charging for, let's say, the dish of the incubator itself, I think using it becomes slightly more justifiable as compared to charging a hefty sum for using time lapse and the algorithms that are associated with it. Just to give the audience a brief overview of this technology, it's basically an incubator which has cameras attached to it, and these cameras click photographs every 5 seconds. All of these photographs are stitched together to form a time-lapse video. And looking at this video for the whole 5 to 6 days of culture, the embryologist can then actually see each and every developmental checkpoint and then look at the morphokinetic data, which basically means when was the embryo a four cell when it was supposed to be a four cell, how did it become a four cell, was there any direct cleavage or reverse cleavage or multinucleation. There are lots of things that we can actually see with this incubator. And then it actually deprioritizes embryos based on its algorithm. So if I have 10 blastocysts for that patient, it'll give me a score, and I will only try and choose the embryos which score the highest using the morphokinetic parameters, which supposedly should give me 19% more clinical pregnancy rates, but that's the data that is controversial and questionable. So, but all said and done, even if I don't look at any of these evidences, if I just look at the incubator as an incubator, it's one of the most robust incubators out there. And you don't need to take the dish out. You're minimizing exposure as much as you can. The gas mixing is fantastic. I mean, it stays stable throughout. Uh, I really like it, and it's a very good tool for patient counseling as well because when patients see the videos of their embryos developing, somehow they also get attached to it. And I mean, it's becomes easier for us to communicate with them as embryologists.
True, true. there is some kind of an emotional stimulation that is
Yeah.
generated both in the doctor and the patient. While we're talking about the embryos, we're looking at them.
Mm.
So, what is your view on something that I'm sure that you've been asked this question in your career, probably the most commonly? So, your view on the PGT.
Okay.
So, when is it most beneficial, if I may ask that way?
I think I when I started, I was quite against PGT because then the evidence was really not for it. And we're talking about PGT-A. We all know PGT-M is super beneficial for patients and it does help in avoiding transmission of genetic disorders and throughout the lineage of the patient's family. So that, no doubt about it, works wonders for them. But PGTA was something that was very controversial. But now, when I look at the new evidence, um, we now, even HFEA has started saying that it can be a very good tool to reduce miscarriages for patients, and they've given it a green signal for it. So that's one category of patients that would really benefit from PGTA. We know that we are getting more patients now that are of the advanced maternal age and even advanced paternal age. And again, this is a category of patients where we suspect that their embryos will have a higher chance of aneuploidy. And when I talk to a patient and when I tell them that, okay, looking at your age, almost 50 to 60% of your embryos can actually be aneuploid, all of them actually want to opt in for PGTA because if I have 10 embryos from them and if I say six of them are going to be aneuploid and I want to give them a pregnancy or maybe even a live birth at the earliest, they would want to try with only those four embryos. And this really changes their perspective. I think our population also has become more educated and aware about these technologies. And I'm now seeing a far greater adoption of PGTA in Indian clinics, especially in this category of patients. For younger patients, it's generally not of any use. Um, Again, another point that I wanted to talk about PGTA would be that most of the studies actually look at cumulative live birth rates. And for the Indian population, that's something that does is not of much value. So here everyone's more concerned about time to pregnancy and they are not backed by insurance. They're paying out of pocket. They do not want failures. So I would say it's a tech that can help them.
Yeah. I've actually seen this, practicing in different time zones, that cultural variation is huge.
It is.
Actually, there is no variation in technology.
Yeah.
The whole variation is only how the embryologists think, how the doctors think, how the patients, most importantly, think, and what do they expect. Some patients can respond to a miscarriage way differently than the others. Like you mentioned, the cumulative pregnancy rate and time to pregnancy become relevant parameters depending on the cultural expectations of the patients. So,
Absolutely.
the
And in India, I think insurance plays a huge role
Hmm.
because when you look at the Western world, their cycles are insured, they're not paying out of pocket. So it doesn't pinch them as much as it pinches someone who's maybe selling their property to get treatment. I mean, it's a really different ball game altogether.
Yeah, we can talk for the whole episode about this
Yeah,
particular
we
point
can.
that you said. I'm trying to control now, not to speak on that. Moving forward, so from your experience, what are some myths and misconceptions patients have about embryology and IVF in general?
Okay, I think this is something that probably is common all across our country. Most of our patients come with the belief that IVF gives 100% results, and it is very difficult to then talk to them about no, the results are only going to be about 50 to 60%. Live birth rates are only going to be about, let's say, 40%. there's still a chance of miscarriage. I mean, you'll really have to counsel them. And sometimes it really dissuades them because there are clinics out there who are marketing 70%, 80%, even 90% success rates. And then once they come to a doctor here, or once they come to me, I'm saying, okay, no, 50%. It is
It's them.
problematic. It's
Yeah,
very tough.
hard.
It's very tough. But I think in time they will also realize that world over and globally speaking, these are the results.
Mm.
I mean, there are certain gimmicks that really need to be avoided within the country. Um, I think another misconception or a myth that they have is IVF always gives you twins, and some walk into the clinic actually wanting twins, and then we have to counsel them. No, there are so many negative repercussions of carrying a twin pregnancy, like premature delivery, NICU stay extended, etc., etc. And we really nowadays, I think, are trying to really push hard for single embryo transfers and just trying to give them a better and a safer outcome. So that's the current challenge that I think we are facing. I think that's those are the two common myths
Mm.
that
Yeah,
we.
yeah, yeah, I agree. Now I want to speak about something more about your family before we
Oh,
close. So, before the family, I would ask you, was it any different that you were a doctor and then shifted the line to embryology, or as compared to if you were straight away just going into the, bioengineering line? Did it help you to become a doctor first, or do
I
you think it
I
is of no consequence?
I think it really helped me because now I can counsel my patients better because I have that medical background. And it's very important for embryologists to actually learn this communication skill because this is not taught in a master's course or a graduate course in biotech. You're never facing patients. And if you're never facing patients, you're never confident enough in talking to them. And that's where I think most embryologists also shy away from speaking to them. They're happy within their own space. I am privileged to get the best of both, where I can talk to my patients, I can be in the lab when I want space, and like I don't want people to disturb me. I think it's really helped me. Plus, also knowledge about basic knowledge about how things work. I think an MBBS degree really helps me with that, and I understand embryology better because of it.
Mm.
Uh, I really feel it's been easier for me, but it's not been easier for I would say that when I actually decided to do embryology, it was tough for the family to actually digest it. That was a challenge. That was the biggest challenge. Everything else was
How
easy.
did you convince them? Because they are heavily like the most patient-facing family in the country. Probably the larger part of the world, the number of patients that your family face, and then you
Yeah.
deciding to not face the patients. So this particular thing, how was it? I always get very intrigued by this point.
It was tough because I actually graduated with a gold medal in MBBS, and then deciding that okay, I don't want to do this anymore. I want to do something behind the scenes. I think Dad was the first to actually accept it, and then
Oh, wow.
push me a little
So,
bit more.
so unexpected. I mean, I'm shocked because he's the most clinical person I can think
So
of.
he pushed me towards it. And then ultimately I got into Monash and I got into Oxford at the same time. I think that's when mom also started softening up to it. And then we did some research and I chose Monash. And yeah, I think the rest is history. I think now they are happy that I made this choice because the timing of it was the best because at that point of time, India did not have a lot of qualified um, embryologists. And I think this brought in a change within the country itself. I personally feel that it has. And I was able to make a big mark for myself because I entered at the right time. And then obviously I had the backing of both of them. So I think it's been a very good journey so far.
And it's been great talking to you, Keshav, today. And I'm very glad that we took time out to create this podcast and this episode. And it is so important to keep in touch with people who are excelling in this field. And you are a star. And I'm personally very proud of you. And thank you to all the audience to have taken time to listen to the podcast today. And we'll be actually connecting again, hopefully soon. Thank you
Super.
very much.
Thank you, Dr. Anu.
Thank you, Keshav.